Good morning, everybody. I'm Roberto D'Angelo. I'm a psychiatrist and the president of the Society for Evidence-Based Gender Medicine. It's my great pleasure and honour to welcome you to SEGM's first official conference, International Perspectives on Evidence-Based Treatments for Gender Dysphoric Youth. SEGM is a relatively new organisation, so I'd like to say a few words about us. SEGM is a registered non-profit organisation free from political, ideological, religious or financial influences. We formed in 2019 in response to the sharply increasing numbers of children, adolescents and young adults who reported gender dysphoria and were seeking help from medical professionals. At that time, we noticed that the field of gender medicine was not operating according to the principles of evidence-based medicine. The prevailing treatment guidelines for youth were not, and still are not, based on quality systematic reviews of the evidence. The quality of the treatment guidelines remains therefore poor overall, and these guidelines do not adhere to the principles of evidence-based medicine. Clinicians practicing evidence-based medicine know that recommendations and guidance that do not use the best current evidence risk promoting suboptimal or even harmful care. While SEGM is a non-membership organisation, we collaborate with more than 100 clinicians worldwide on a range of projects aimed at our core mission, raising the bar on the quality of evidence in youth gender medicine. Since our inception, hundreds of clinicians have contacted us expressing their concerns about the state of youth gender medicine. They have also told us that they are too afraid to speak out for fear of losing their jobs or their professional standing with colleagues. When clinicians are afraid to voice their concerns about a clinical pathway, this puts patient well-being at risk. At the same time, we recognise that cancel culture in medicine is real, and these clinicians are afraid to speak out for good reasons. So I would like to thank everyone courageous enough to participate in this discussion over the next 2 days. We know many of you have done so despite the backlash you've received. I would like to point out that the invited speakers do not agree on every point related to youth gender medicine. In fact, I suspect many may strongly disagree with one another on a number of points. However, these respected experts recognise the critical need for dialogue on the topic of youth gender transition, and we thank them for trusting SEGM to provide the forum for these vital discussions. I also want to reiterate that while we may disagree with one another on several or many points, we all share a common overarching goal: to provide the best possible care for children, adolescents, and young adults suffering from gender dysphoria. It is this shared concern and conviction that is shared by everybody in this room and unites all of us who are here and attending online. During our time together, we will trace the evolution of the gender-affirming model for youth and examine some of the foundational research. We will investigate what is known about the etiology and developmental origins of youth gender dysphoria. We will discuss the findings from the existing systematic reviews of evidence and learn about new, soon-to-be-published research. And we will interrogate widely used clinical guidelines that inform the practice of youth gender transition. Today, we are witnessing a divergence in clinical approaches to the management of gender dysphoric youth. A growing number of European countries are reclassifying medical gender affirmation of youth as an experimental intervention available only in research settings, and as a consequence, they are strengthening eligibility criteria. In these countries, psychological care and support have now become the first and often only treatments available to most gender dysphoric youth. In contrast, the US medical establishment currently endorses the gender affirmative model that insists that gender transition should be widely available to all youth who wish for it, while psychological care, on the other hand, to alleviate gender dysphoria, continues to be stigmatized and mistakenly characterized as conversion therapy. We will discuss this divergence in these treatment approaches and the rationale for the European changes. We also will talk about the challenges facing scientific and medical institutions in the United States in particular, their reluctance to accept the findings and conclusions of recent systematic reviews of evidence, and their disinclination to update treatment guidelines based on the most current, best available evidence. We look forward to spirited, respectful discussion and debate. In medicine, as in all of science, discussion and debate are the essential mechanisms that enable the field to self-correct, progress, and advance. The history of medicine is rife with triumphant feats and tragic failures. Unfortunately, it sometimes takes years or decades to distinguish between the two. Debate shortens this journey. I would now like to introduce our first topic, Gender, Dysphoria and Youth, Historical Perspective.